How are you today? Come on in. Go ahead and have a seat. Yes, Mom, you may have a seat right next to your daughter. Yes. Let me close the door to give us some privacy. Great. Okay, well, we just want to welcome you here to Dr. Banana's Orthopedics. And my name is Chastity, and I am the surgery scheduler and coordinator for Dr. Banana. And we are here today to discuss your surgery, your upcoming surgery that you have scheduled with Dr. Banana, and just to kind of go over some of the things of what to expect before and after your procedure. If at any time you have any questions or you have any concerns or there's anything that I'm discussing with you you need me to elaborate on, please feel free to stop me and I will be glad to help and answer any questions, okay? Okay. Well, let's get started. All right, so we do have your set schedule. Yes, we have you scheduled for your surgery. It is scheduled. We couldn't get the date that you requested, which was April 12th, but I was able to get you the first available with Dr. Banana, April 25th. Yes, will that work for you? Great, awesome, great. Okay, so we got you scheduled for April the 25th at 9 a.m., and we need you at the hospital at 7 a.m. Now, the reason for that is because we need to get you to the hospital just to make sure that you're registered. That's the first thing. We also need to get labs, blood work, urine samples, things of that nature. We'll also have you meet the anesthesiologist, and the anesthesiologist will go over with you the different types of anesthetics that he will use and what will work best for you. So we'll need you to come in 2 hours prior to your surgery just so we can take care of everything and just make sure if you have any questions before the procedure or if you even maybe want to back out. Hopefully you don't back out. You're able to do it at that time. Okay? Any questions? Okay, let's continue. Okay, so what I always like to tell my patients the day before their surgery, it is very vital and it's very important that you have nothing to eat or drink 8 hours prior to your surgery. And the reason for that is we cannot have you come in on a full stomach. So, no bacon, eggs, and pancakes, and coffee and milkshakes for breakfast. We need you on an empty stomach. So that way it will avoid complications from aspirating fluids that could possibly come up. Because people do actually, they get sick from the anesthesia. And some of them vomit and some of them just kind of respond differently. So we don't want you to get in any distress or have any issues with that. So we tell all of our patients nothing to eat or drink after midnight the night before. Okay? Any questions? Am I moving too fast? Okay, great, awesome. Okay, so what to expect a little bit after your surgery. Dr. Banana will put you in observation, and normally you're in observation for about an hour to an hour and a half. We put you in observation just to make sure, to watch you, to make sure that you're responding effectively to the pain medications that we've given you to control the pain because you'll have some pain. We also want to make sure that you're coming out of the anesthetics like you should. So the anesthesiologist will be monitoring that also, just to make sure that you're A-okay before we let you leave the hospital. Okay? Any questions? Mom, any questions? Okay, great. After the hospital, you'll go home. And typically, with this type of procedure that you're having, which is going to be a reconstruction of deformity in your left foot, it is required that you will be off of work or school, whichever it may be, for at least 6 to 8 weeks. Yeah, I know, 6 to 8 weeks. It's pretty extreme. But for this type of injury, it's very important, it's very vital that we have you off of that foot for as long as we can, just so that it can heal. Do you understand? Um, so for the first couple of weeks, there will be no weight bearing. And non weight bearing means that you will put no weight, pressure, nothing whatsoever on that foot. Okay? So nothing on that foot. So that means you can be lazy for a whole 2 weeks. If you want to sit in bed and watch TV, great. If you want to sit on your computer, on your laptop, and play games, great. That's what we prefer you to do. But nothing for 2 whole weeks. During the process, usually 5 days post op, we'll have you come back in to see Dr. Banana. He'll take a look at your incisions just to make sure they're healing like they should be, just to make sure there's no infections or anything like that going on. We won't take your stitches out, but we will have you come back in 10 to 12 days to remove your stitches, pending if everything is looking okay. Any questions? Okay, great. Okay, so you'll come back to see him for your post-op, and then we'll set up another post-op 5 weeks from the first one. So it will actually be your 6th week post-op, and we are going to put you in a cast, and we'll have you in the cast for probably 2 to 3 weeks, and then we'll just kind of go from there. But in between the time, we're also going to have you in physical therapy, just so we can get you back used to using that leg, that foot again. So have no fear. We're going to take good care of you. Any questions? Mom, any questions? Okay, great. Awesome. You guys are great. So, once again, if you have any questions, my name is Chastity. I'm so glad that you chose Dr. Banana Orthopedics to have your surgery done. Like I said, he's an awesome doctor, an awesome physician, and an even more awesome surgeon. He will take wonderful, great care of you. Okay, so have no fear. You look a little nervous. It's okay. He's going to take really good care of you. Okay, so again, if you have any questions, feel free to call me. My name is Chastity. I'm the schedule coordinator. If I'm not available I'm sorry, I am available between 8 and 5 every day, Monday through Friday. Um, After Fridays, weekends, after 5 p.m. during the weekdays, we have what's called an on-call service. So feel free, no matter what time of the day or night, to call, and we will make sure that we get someone back to you. Okay? All right. Well, great. Okay, well, thank you. And I hope that you both have an awesome day. And you can just head to the front and schedule your pre op with Dr. Banana. All right? And we'll see you April the 25th at 9 a.m. Goodbye.